Do you think I should change my background, put a virtual background on?
No need.
No, I was talking about me because there's a lot of stuff behind me.
It looks fine, Kelly.
Okay. I got this one.
I'll be right back. Our AC turned off up here. I'm going to go turn it back on.
Okay. I got this one. Is that too goofy?
No.
This one, a friend of mine who's an editor in Hollywood, a friend of his made this. And the actual, when he sent it to me, it's actually the water moves inside this picture.
Oh, wow.
Do it as a virtual background, but it actually has waves flowing. I think it was a surfer guy or something.
Wow.
Okay, we're 1 minute to countdown.
Excellent.
Okay, let's get started. I don't want to waste any time because I know our Lieutenant Governor, her special guest, has been up since 3 a.m. this morning. All right, aloha kako, everybody. I'm Councilmember Kelly Takaya King, your Maui County Council member for the South Maui District Residency. I'd like to welcome all the viewers at home and across virtual space who've joined us for COVID-19 Town Hall Webinar 2.0. Tonight's Town Hall is a follow-up discussion to the event we held last month during our first Town Hall webinar on the topic of the current pandemic. Like our last event, tonight is an opportunity for citizens to hear from experts and elected officials in the interest of facilitating greater communication, transparency, and effectiveness in our community's response to the COVID-19 pandemic. For updates on our next Town Hall webinar, which will feature United States Senator Brian Schatz, follow my Facebook page, Kelly King-Maui County Council. This Town Hall webinar is also being streamed on that Facebook page and will be recorded for future viewing on Akaku Channel 53 and YouTube. Questions from the public will be taken via Zoom only. And due to the huge response to last month's Zoom Town Hall, we have expanded capacity to 500 participants. To join Zoom webinar, use the meeting code 939-9352-6092 or go to the Kelly King Maui County Council Facebook page and there's a direct link there. For those in Zoom who wish to ask questions, please wait until the speakers have concluded their remarks, then use the Q&A function in the toolbar at the bottom of the screen to type in your question. Questions will be monitored by staff and posed to the panelists to answer on air. Please read through any pending questions and upvote questions you would like asked rather than repeating the question. You can also use the Q&A function to review questions which have already been answered or clarified. Your mindful use of the Q&A function is appreciated and will ensure that we are able to efficiently address as many questions as we can. Tonight, we are joined by Lieutenant Governor Dr. Josh Green and County Deputy Managing Director Josiah Nishita. Aloha, Dr. Green and Mr. Nishita, and thank you so much for joining us tonight. Tonight's discussion will include essential updates on the state of the pandemic in our community, specifically vaccine distribution, COVID-19 variants, and mask supply and effectiveness. We will begin with the update by Lieutenant Governor, followed by comments from Mr. Nishita, and then go to a public question and answer session. And we really do want to spend most of the time on the public's questions. But as a short introduction to where we're at right now, this week, the US reached the grim milestone of 500,000 COVID-related deaths. According to the New York Times, that makes our nation's total virus toll higher than any country in the world. We account for just 4.24% of the global population, but the US has reported about 20% of the world's known COVID deaths. COVID-19 is now a leading cause of death in this country, alongside heart disease and cancer. Despite the monumental damage this disease has taken on our communities, there is hope that we are turning a corner. The 7-day average of new cases in Maui County has come down from 35 as recorded during our last town hall on January 11th to 16 on Monday, February 22nd. During that same period of time, our county's test positivity rate has also fallen by more than half a percentage point. According to the Department of Health, as of yesterday, 8.5% of our county's population has received at least one of the doses of the COVID-19 vaccine. Yet Maui has executed less vaccinations by population percentage than our sister counties. Civil Beat just announced that they will shift from daily to weekly reports as the numbers reported daily are often inaccurate due to yet unreported information. The Department of Health used to report how much vaccine was being sent to each county and the percentage of application. Now they are just showing the percentage of the population that has been vaccinated. With today's town hall, I'm hoping to sort through the confusion and provide a clear picture of what is going on in our response to the pandemic. And so now, without further ado, I'd like to turn to our Lieutenant Governor, Josh Green, who will talk to us about vaccine supply and distribution, COVID-19 variants, masks, and other physical distancing measures. Josh, take it away.
Thank you, Councilwoman. Thank you, Kelly. I'm gonna just first say thank you for including me. It's an extraordinary time. That's not lost on anyone. The state has done very well as compared to the mainland, although, as you pointed out very eloquently, it's just been a disaster for America. And you're absolutely right. We've had 500,000 plus deaths, just over 500,000 out of the 2.5 million deaths globally. So 20%, almost exactly. Yet we have just about 4% of the population. I thought it was bad when we had when we were doing the opioid epidemic, and we have 4% of the population, yet we consumed 80% of the world's opioids. So you see that there are times where we don't do as well as we should. I'm going to speak, if I may, just briefly, and I have a couple quick slides to give an overview, and then I can't wait to dive into every question. I would comment that Hawaii has done far better than the mainland. I mean, far better. And so here's just a couple slides to share with our Maui friends, brothers, sisters, and rest of the family. So here we go. Just a couple quick things here. All right, if I may. Okay, so just a couple quick pieces up. Can you see this okay, Kelly?
Yep, we can see it.
Okay, thank you guys. So for this last week, this gives you an idea of where Hawaii is nationwide. And I know it's less of a consolation because the numbers have been slightly higher by percentage on Maui, though you are really, I have to say, doing extraordinarily well compared to the rest of the nation. We are, I have incredible numbers of friends and family on Maui, but you can see we're all the way in the left there. Hawaii has got far lower infection rates than other states. I mean, we're like less than half based on the recent infections this last week. And that's actually held across the course of this pandemic. You can see here that we are also lowest now in the nation for infections per 100,000 people, far, far lower than many states that, you know, include a lot in the Northeast corridor. But look at that, we're even lower now than Vermont and Maine, where we're rivals in a good way to be lowest in the nation. And of course, I'll share all of these with the group. You can have any information you need. I'm happy to provide it. Now, looking at the death rate, which is really in many ways the most important thing to us at the end of the day, keeping our families alive and safe, you can see that we've had the lowest death rate of late. Our low numbers are, yes, they are due often to closures we've had. They're due to a lot of things, including mask wearing, and I'll touch on that here in a moment, and social distancing, and a lot of hard work by many people. But you can see we have the lowest death rate in the last week. And also here, if you look at the death rate nationally, this is no coincidence. I mean, we have the lowest, and it's been through good hard work in the hospitals, making sure we have access to care in spite of challenges that do exist. And, you know, I just say this for perspective, not that I'm ever making an excuse. It makes me crazy when we don't vaccinate more people, or we have a delay, or someone screws us over and we don't get the masks we deserve. I mean, I get all that, believe me. I still work in the hospital. I was on call this weekend, and I treated 3 people with presumed COVID, and it worries me a great deal. Okay, so here you can look, just a quick comparison. I picked these 2 dates because they're about 6 weeks apart, so it's about 3 cycles. And also January 5th on the left reflects right after Christmas, New Year's holiday period when we had a surge, okay? And then February 23rd now represents a period after those smaller holiday, Valentine's Day and the Super Bowl, which I hated because my team wasn't in. But it still reflects when we were gathering, right? And so I wanted to give these comparisons, and you can see that on January 5th, after the holidays, our hospital numbers were somewhat high. There were 105 people in the hospital with COVID, and it's decreased very dramatically. We today had only 37 hospitalized statewide, of which 8 were on Maui. Okay, so that's something to marvel at. Actually, the numbers, how they've come down, and you can see the case counts dropped from almost 140 statewide a day down to an average of 49. And here are the comparisons by county and state. So the positivity rate statewide has been dropping very significantly. This tells us a couple things. This tells us that we are decreasing our case rate, but it's also telling us that we don't likely have a large number of some of the variants. And this to your question, Councilwoman, that we don't have a large number of the UK variant. We're not seeing an undue surge, although we worry. We worry, especially right now on Maui, where the positivity rate has, though come down, like you said, has hovered higher than we would like. And if you just compare the counties right now, one county goes up, one goes down. This is very common. There was a time when Maui was far lower than other places, and times where it can be higher. As you can see, the surge has really died down on Big Island. They've had the luxury of a lot of extra testing and are very spread out. I mean, there's large distances between people, and that's helpful. City and County of Honolulu's numbers have dropped, and they often have access to extra infrastructure, no doubt, and that can help. Sometimes it's not helpful because there are a lot of people in Honolulu gathering. Kauai has remained utterly closed and has done very well, keeping cases at bay, but it comes at a great price. It's really difficult on people that aren't working, but these are the considerations that we make, policy considerations. And then finally, as you can see, Maui, the numbers of cases have been dropping significantly, and they've dropped it had gone even up from January 5th, as you know, and then back down, which you said quite clearly. So I expect the numbers to continue to drop, and Maui, you've done well, but it sometimes doesn't feel like it because you want no cases. I totally get it. A couple other pieces of data I thought might be interesting for tonight. This does sometimes affect the numbers. These are some of the clusters that were reported, and you can see that there was the correctional facility cluster. I was asked by the Director of Health's team to mention that the Maui District Health Office has begun to vaccinate the MCCC inmates and focus on the elderly and those with underlying health conditions. So those who are at higher risk of having much worse disease are getting cared for. It's important to always mention that outbreaks in prisons, though we have a bias sometimes about whether or not to put extra attention on prisoners, they are in a grave situation in many cases. They can't separate. And they will end up in the hospital and hospital beds otherwise. They have a lot of underlying health problems. So that's true of anyone in an institution. And you can see some of the other clusters, cluster of 10 in the travel system, and not a lot of other clusters. There's not a lot of cases overall. The total number of cases has been modest. It's been 202 cases in the past 14 days, just so you know. And there were 17 new cases today, as I'm sure everyone heard, which is down significantly from yesterday. Yesterday was scary, and it was disturbing because I know it's not pleasant to hear that Maui has more cases than Honolulu at all. I'm sorry for anyone who's from Honolulu listening to this, but that is, distressing to us. And so it's probably timely that we're together. Just a couple other quick slides. You can see that Maui does a very good job wearing masks overall. There are times when people don't. You can see with the statewide numbers, you're above the statewide average. Kauai County, because there's so few cases, have not often had mask wearing issues, nor have they worn them on occasion. Numbers have dropped lower, but they're doing a good job keeping the disease at bay. And you can see you're right parallel with Honolulu. Big Island has kind of doubled down on mask wearing of late, and it's probably something worth noting because you can see their numbers are extremely low at the moment. And mask wearing is, I would argue, probably the best thing we could possibly do, maybe even more valuable than vaccinations at the present. It's certainly very helpful. We will talk a little bit more about distancing, washing hands, and avoiding gatherings. That's the magic of this whole thing. But you want to talk about vaccines, I know. And so real quickly, that arrow does not, I've been fighting with them about where that little arrow sticks on the phase 1B. We're about 2/3 of the way through phase 1B, and we will quickly move to 1C in a moment. 2 weeks, I should say, really 3 weeks, but I'm going to break it down for you. We've done 312,000 total vaccinations. You guys are reflecting right now 25,000, which would be, that's why you get 8.6%. I hate to be the bearer of this news. I'm just the messenger, and it's not to criticize anybody. There's about 10 to 12,000 undercounted so far vaccines that haven't been put into the VAM system, because some of the health people who I have utter respect for on Maui, and even though we sometimes argue or disagree with one another, they're doing what I often have done as a physician, which is do a paper chart and then later translate it into the digital system, because sometimes the digital system is onerous. So when you calculate those 10 to 12,000 additional people, you're right smack dab par with Big Island. And that may not be very satisfying to see on a curve, and it causes us concern, but you really are doing the same as everybody virtually, with the single exception possibly of Kauai, who is so small that they're able to accelerate in some cases because their populations of high-risk people are smaller. So here are some of the raw numbers. This was one from yesterday then to today, okay? So that's why 312,000, we did 5,673, and that was up from yesterday at 306,000. We've ordered over 400,000 vaccines. As of this moment, we have 385,000 in state. And we've delivered, as of this moment back here, the 312,105. We will tonight update our numbers for tomorrow. Probably be another 12,000 people were vaccinated today statewide. And you can see that not all of the data has been accounted for yet in the VAM system, because there is just extra vaccine work that's been going on. We get a lot of extra vaccine this week because of the storms last week on the mainland. As of yesterday, a significant number of doses arrived. It was just over 50,000 doses arrived. And that was quite important because we needed those doses. That was 34,000 of Moderna and 15,000 of Pfizer's vaccines. Now, what did that mean to Maui? Maui yesterday received 2,500 Moderna shots and 2,340 Pfizer. So that was 4,840, which was 10% of the total that came into the state. And our population on Maui is 10% of the state's population. So I want to reassure people of that, although there are moments I know. I'm a neighbor island guy, and it often does not feel like that, but those are the numbers. Also, the public health nursing staff took 40 doses over to Kalaupapa, which was very nice to do. You have additional challenges. You have several islands in the county, and that makes it harder to do what you do. And then finally, a couple numbers. This is the number I think that made people upset here in a moment. So the state's tracking at about 13.6% getting at least one dose. And so you can see these charts, mostly over 75, not all over 75. Some are first responders, some are other people in certain industries that we have to kind of keep the power on and so on. It's not perfect, I admit, but we're attempting to be as focused on kupuna as we can. And you could see here are some of those numbers. Now, it was reflected that 8.5% of the people in Maui have received a dose, as opposed, say, to Big Island at 12.7%. However, when you account for those 12,000 doses that are not yet in the VAM system, you end up with exactly the same number as Big Island. And it's just something that I was told to report, because I went and investigated on behalf of the mayor. And I have a ton of respect for the council, a ton of respect for the mayor. Very difficult times to do these jobs. Tangle with the hospital sometimes, just love what they do overall. Though there are moments where we all, have our doubts and we struggle. So this is a reflection of where we are. You can see Kauai has been able to get ahead a little bit, but they've really been receiving the appropriate number of doses, with a small exception that trays don't often get broken up. So in some occasions, if you are a fraction of a tray, you may benefit, because we don't short people. We try to at least cap it off. And Kauai, as some of our other neighbor islands, only has limited healthcare resources. And so they're pushing forward, just like everyone is trying to push forward. A couple more quick things, Kelly. These are, and I won't dwell on these are the reflections of what the phases are. You could see that we have to get these vaccinations into people because of the variants, although the variants on Maui have not been bad. It's just very few variants that we've found in the whole state. But phase 1A was 40,000 healthcare workers and 10,000 people that are kupuna in long-term care facilities. They're now safe, or very safe. 1B, over 75, that's 109,000 people who are over 75 in our state, and 50,000 frontline workers, or people who work in close proximity to others. That's another 150,000. We're virtually done with this group, and we're moving quickly to the next categories. Here's a description of the frontline essential workers, the prioritized ones. Everyone is valuable, but there's a national desire to take care of schools, get our kids back. National desire, of course, to keep corrections facilities from having big outbreaks or utilities from crashing like they had in Texas. So there are issues, right? And then we can come back to any of these, but here's 1C, which we'll be accelerating into in 2 weeks. I think it's going to happen maybe even a little faster because we're getting more vaccine rather than less, mostly because Johnson & Johnson will get approved soon. We'll talk about that. We're going to start with 70 to 74, then we're going to do 65 to 69. Also, the people who have extra disconcerting underlying medical conditions will get some priority. The 3 categories for that will be people on oxygen, so they have lung problems, people with cancer and getting chemotherapy, immune problems, and finally people on dialysis, highest mortality risks. But we will move aggressively through the 1C category so that we'll get 100, we'll finish 350,000 shots off by March 1st. We'll finish 600,000 shots off by April 1st. We'll finish 900,000 shots by May 1st. And then you can see that we will be substantially safer, not out of the woods, but safer. Last considerations, you can see that we can do distribution between phases, although we do defer to the counties the best we can. The vaccinations are distributed mostly to the older individuals in each group. They can be redistributed if there's an outbreak in a community. Like you said, of the nation, we are a bad subset of the world. Well, our non-Hawaiian Pacific Islanders have a small population in Hawaii, and we're about 30% of the cases. So it's good to also help them a little extra, perhaps. And then finally, you could see we prioritize where people live in multi-generational houses, perhaps in poverty, because again, the spread can be quick there. We'll get to phases 2 and 3 in the summertime. Phase 2, very low risk people who are younger. Phase 3 would be our keiki. Right now, it's not been approved for them yet. Here are the basic vaccine resources, which everybody knows, hawaiicovid19.com, or so you can register there. The registrations will begin to open a lot more easily because of the 74,000 shots that are coming this week. I'm sorry, 76,000, 50 already, and another 26,000 by Thursday, it looks like. And then next week and the following week are pegged to be 53,000 each, plus if Johnson & Johnson starts. And so just mahalos, and use my social media if you want my 1 minute or 2 minute update every day. I hope it can be helpful, and you can pose questions and press me on issues if you like. So I will stop there. I'm sorry for going on. I thought it might be a good overview. And then specific to your issues, the Director of Health tells me that there have not been significant surges of variants. We've seen statewide that we've had the variant out of Europe that was also endemic in California, the Denmark variant. But we're sampling 75 cases a week, 300 a month, to see if there's a surge of, like I said earlier, the UK strain. It's kind of like a cockroach, right? You find a couple, that means there's more cockroaches behind the dresser. But we got to look for them, and we have to look in clusters, and we should pay extra attention to Maui, where the rates have been a little higher, and not terrible, but higher than right now, of course, a couple other places. You also asked about masks. We'll talk at great length, but the basic statement about masks is yes, N95 masks are much better. They take down 95% of the particulate matter. N99s, which are available and very, very hard to get. I don't know if I've ever worn one, take down 99% of the matter, harder to breathe in. Double masking is absolutely sensible. You will stop extra debris or stuff getting through there, or a filter in a cloth mask is also a good idea. And we do have the opportunity to acquire more masks. It costs money, but we do it through the Healthcare Association of Hawaii so we don't get ripped off, because there's a lot of scammers out there. And so that's my overview. And I just wanted to thank people for understanding that I don't have all the answers, but I'll get you all the answers I can get. And overall, we're really moving rapidly toward a much better phase of the pandemic, but we should not let our guard down just yet.
Okay, thank you so much. And just real briefly, is there a difference between the N95 and the KN95?
The KN95 are the ones made in China specifically, but they do work. They're more likely to be counterfeited, but I've worn them. They're pointy. Those are the pointy masks. They do work. Anything that conforms to your face well, where you can get a pinch over the nose or has some kind of adherence to the face, is better. Everyone keeps giving me superhero masks, and they're wonderful, but they don't cover anything. I breathe right over them, and when you sneeze, the snot comes out of them. So it's not perfect. So it's good to have some kind of filter in there if you can.
Okay, great. And I have seen people doubling up on masks a lot lately, so that's great. Thank you so much for that information. We're going to go next to our Deputy Managing Director. And then after Josiah speaks, I'm going to, we have Representative Tina Wildberger on. So she had some specific concerns that I've been talking to her about. So I'm going to let her kind of pose the first question to you, Josh. And really want to thank her for all her concern and hard work as well. But we'll go next to Josiah Nishita. You want to just give us, your thoughts on what we just heard and where we're at. And you might also address, some of the confusion in trying to sign up for the vaccine, because today I received an email from saying that I was qualified, that I can go and sign up for the drive-through. And I tried to do that. And then I got an email back saying you're not on the list. So got an email saying I was on the list, then I got an email saying I wasn't on the list. So there's that kind of stuff happening, I think, to a lot of people. So if you can talk about that too, Josiah, if you know anything about where we're going with trying to streamline the distribution and the application.
Okay, no, yeah, thank you very much, Councilmember King, for having us on today. Thank you, Lieutenant Governor Green, for participating as well. I know this is very needed for our community. It's great to have continued dialogue about where we are, where we're going, and as we look forward to continue working together for betterment of our residents. Just as an update for our Mask Up for Maui County program, that's a program to increase face mask usage throughout the county. As Lieutenant Governor mentioned, face masks are one of the primary ways that we can really keep our community safe. And especially as people wait for vaccinations to occur, we still want to hammer those safety measures in, home to people, such as physical distancing, not gathering in large groups, and definitely wearing face masks. So, according to the Hawaii Department of Health data, the proper face mask use in Maui County had reached 96% about mid-January, and recently slipped to about 91%, I think they reported recently. Volunteers of this program, the Mask Up Maui County program, will approach unmasked individuals with a copy of Maui County's public health emergency rules and help explain to them about the mask requirements and being required in public areas of Maui, Molokai, and Lanai. Volunteers will also be able to present them a complimentary face mask if individuals do not have one. The first Mask Up for Maui County volunteers come from Lahaina Town Action Committee, Lahaina Restoration Foundation, Clean and Safe in Lahaina and Wailuku, security teams from Shops at Wailea and Lahaina Gateway, Hope Chapel and Kihei, Anti-MOPSI and the Protect Paia group, and Maui Police Department's community police officers. So if there are any individuals or organizations that are listening and want to join the effort, you can call Community Liaison Ellen Fukuyama from the Office of the Mayor at 808-270-8299. But yes, we do really want to stress to people that wearing masks is really important, and it's one of the primary things they can do to help protect us. Just as an update to our community testing programs that Maui County offers, from October 16th through February 21st, our free community testing programs have done about 23,600 tests, with about 512 positives found for a 2.17% positivity rate. About 8% of the positives in those programs have been from visitors, which is obviously travel related. About 12% have been residents with some sort of travel connection, and about 80% have been residents without any travel history. We did report 17 cases today in Maui County. Just as a note to some of the high cases that were reported recently, I think it's really helpful for individuals to go back and watch, if they didn't, the mayor's press conference yesterday. Department of Health epidemiologist Spencer Headley was on and did a really good job at explaining some of the cases that have come up recently, and specific to household units, large household units. So, when they evaluate data and look at the health of the community, they really do look at where these cases are coming from. So I think what Dr. Pan kind of refers it to as like a salt and pepper approach is like where they get a little bit more concerned, where cases are randomly popping up at various areas all throughout the community. Whereas if you have, large households and an individual within the household tests positive, and you get a high acceptance rate of testing those individuals within the household as well, you're bound to likely find more positives just because of the interaction and close proximity in which, these individuals may live. So that seems to be kind of more the majority of the cases that we've been experiencing recently. We did have a 3.4% roughly positivity rate the last 7 days. Just something to note for people that's important for them to know is Maui County does a high proportion of antigen testing. And so what is important for people to note is that the positives generated found through antigen testing is then confirmed by PCR. So, you may do hundreds of antigen tests a day and find, a handful of positives through that. And then those are reconfirmed through PCR. But the PCR counts are the only ones that are getting reported through the Department of Health's data. So, whereas you may do a whole host of tests to find those positives, what is reported is, the 3 PCR tests that were done on the 3 positives found through the antigen. So that does change, the positivity rate in effect. It is something that Department of Health here monitors as well as us. And so, we are able to understand the full scope of what that's saying. In addition, the community tests that we run, we do know that there's about maybe 18 to 20,000 tests that are waiting to be reported into DOH's system. So in the near future, you will see our total test count jump up roughly about that number, including our daily counts. So the positives that are found through our community testing programs are reported directly through the Maui District Health Office, which is reported daily on our case counts. And what's important for the community to note is that the maybe 200 tests that found those positives aren't reported until some point later when it's incorporated into DOH's data. We do have 10.32 cases per 100,000 over a 7-day rolling average, and roughly Central Maui and South Maui have seen, more so Central Maui, but have seen more of the cases being reported right now. Appreciate all the comments from Lieutenant Governor Green. We just continue to work hard to keep our community safe, and we really appreciate all the partners, the state, the Maui District Health Office, State Department of Health, the hospital. All of them have been great partners in really trying to work together to keep the community safe. Obviously, there's lots of things that can always be done better, and we always look for ways to improve and get feedback from the community and others in that process. And so I think that's really important that takes place over time. And it's really been truly amazing to see the community really come together through all the different efforts to serve each other, and we really shouldn't lose focus of that. So thank you very much, Councilmember King, and I'll be available for any questions if there is.
Okay, great. Thank you so much for being here, and thanks for that overview. And I'm going to see if we have our representative, our State House representative, Tina Wildberger, if you'd like to, just kind of pose that question that you and I were talking about earlier today. Since the doctor is in the house. Tina, go ahead, and then we've already got questions coming in, so we'll launch right into the public's questions after yours.
Thanks so much. I'm so glad to have Lieutenant Governor here again with us. We appreciate all of his time and know how overextended and in demand he is these days. Kelly and I had a frank discussion this morning concerned about that 8.5% very low number for Maui County. I did learn what the Lieutenant Governor learned, that we have a data entry logjam with the state health office. And I frankly want them putting shots in arms and not doing data entry. But what I would like to know, I know that Lieutenant Governor is not the Department of Health, but I think that he has a great line of communication with them. The director, Dr. Char, yesterday hinted at national assets being deployed to Maui to help with vaccine distribution. Are you aware of National Guard troops coming over to help up our vaccine distribution? She said that to the pandemic chairs in a meeting yesterday.
There may very well be. So General Har and those guys, Har is our adjutant general, but in charge of the incident command. So he's in charge of the COVID response with me and Director of Health, has asked for those people, and they're giving us money for that. So the question is, do we need it or not? I mean, kind of the more the better at this point in general, really.
Amen.
I mean, the biggest impediment is the number of vaccines, though, because I think that we can, if we had more vaccine, then we could get more into arms at all times. That's why it was so frustrating last week with the storm that held things up in the snow. But
Hey,
we kind of,
Josh, can I just stop you right there, because that segues perfectly into the first question that we had to ask. So
Sure.
I'm going to insert that right now, because
Can I
Maui-
make, Kelly, can I quickly make one more request?
Oh, okay.
Sorry to interrupt. I wanted to point out that Maui's, as of the 2019 population estimates, that Maui has 11.7% of the state's population, and rounding down to 10% does us 2% injustice, which is 20% of vaccine allocation. So if you have any poll, I would appreciate at least getting 12%, because we are receiving a disproportionate amount of travelers, both for residents and visitors coming to Maui. People that aren't choosing to go to Kauai are coming to Maui, and I would very much appreciate, and so would I would be remiss in my representation if I didn't ask for at least rounding up to 12%, so we can get that extra 20% allocation. Thank you so much for being here. I appreciate y'all so much.
Okay, thank you so much. And that's actually the question, the first question that came in is Maui is having such a high number of cases per 100,000, along with a higher volume of visitors. And so can Maui be prioritized for vaccine allocation? So that's kind of the same question in a different way. Maybe you can answer that, Josh.
so the prioritization, which is, through the Department of Health, is a little bit more complicated, although I kind of agree that Maui deserves extra vaccine based on the extra work that it's doing and the extra impact it has on the economy and the extra risk that it takes. So that is all correct. The other consideration is how many individuals are particularly in harm's way. And so this is a catch-22, right? Because we know that on the neighbor islands, we have fewer healthcare workers, for example. We have a healthcare professional shortage. Yet the 1A category was built to do our healthcare community and those in institutional settings, So it was also based on that. So wherever there were more long-term care facilities or special units like ARCHs, adult residential care homes, that is, and developmental disability homes, that also figured into it. But I obviously think that Maui has to get its share of vaccines. We don't tend to calculate, of course, any vaccines in for visitors. I know that's not what we're saying. We're saying our risks are greater in the hospitality industry because we're open on Maui. And those are the individuals right now that should get them. I will say this, that I don't think that there's an expectation that people who are not working currently in a hotel, even though they were on the hotel rolls, if their hotel is closed, then they're not getting expedited vaccines. But all those points aside, yes, I constantly bug the director of health to make sure that the neighbor islands get what they should. And it's an imperfect situation. There's no doubt. The good news is that we're now getting a lot more vaccine. They announced today that Pfizer and Moderna are going to generate an additional 140 million doses more quickly before March 31st. That should be about 50,000 extra doses for us here in the state. Also, I do believe we're going to get about 20,000 doses per week once they're up and rolling of the Johnson & Johnson, which is, though, one shot, it might very well be good for people that are lower risk, slightly lower percent chance to stop COVID, but it has decreased severe illness.
Thank you for that. Is there a percentage of vaccination that we can then return to normal, like 50% or 80% of us get vaccinated? And then also, there's a related question: will there be a vaccine passport? So that we'll know tourists.
Great. Yeah, great questions. I'm sorry I didn't mention earlier. So I believe when we get to 70% vaccination status, that we will achieve a lot more normalcy. But with each increment of 10%, it gets safer and safer because we won't have outbreaks amongst our most vulnerable people, but not safe to prevent widespread disease. So we need to get to at least 70%, it appears, to get more broad immunity, also called herd immunity. And we do seem to be projecting that we're going to get up into the 80s, if not low 90s, once this thing is all said and done. So that's good. I think that it's going to be sometime in the summer, sometime around July 4th, where we should see numbers of that size. I'm projecting by July 1st, 1.4 million shots at least given. And that's probably 600,000 people getting both shots and another 200,000 getting the, main Johnson & Johnson shot. So that's about 800,000 people that would be immune, which is pretty good. We have, we need to get to about 950,000 to reach that strong threshold, 70%. Vaccine passport, and yet, yes, and not to discriminate against anyone who just doesn't believe in vaccines. I mean, that's okay. They can continue to get tested for these purposes. But once people are vaccinated, we expect to have this through either our vaccine registry, VAMS, or the state's registry, the ability to partner with Clear or Common Pass, which are just apps that will be able to show that you've been vaccinated. And that way, let's say somebody wants to have a larger event, but they want to use the criteria. If one of the mayors wants to use a criteria that the majority of the people have been vaccinated, you could do it. Or for travel, I don't personally think there's much value any longer of the inter-island travel quarantines because the positivity rates have been so low. And ironically, in this particular moment, I'm not trying to be sassy here, because it's a little higher on Maui. There's not additional protection based on the positivity rate from, say, Big Island to Maui. They would argue instead that Maui has a slightly higher rate, which we shouldn't discriminate against. So I think that if people are asymptomatic, they should be able to travel. But if you have a passport, I think if someone's been vaccinated, and this is going to be the national law, I can tell you, and international rule, if you're fully vaccinated, you won't be of consequential risk. You might be able to be a small carrier, although the data out of Israel and the early Pfizer data suggests that we are kind of sterilizing the upper airways, so there's not much virus. So you'll be safe, and then you should be able to travel without the pre-test. That will be more travelers, but I'm trying to peg that to when we get through 1C, when we've got a lot of vaccination in our own people.
Okay, great. And the next question is about the N95 masks. Are they readily available for public use? Would you support promoting them for voluntary use and distribution in the community? And while you're answering that, I'm going to go, because I put one out, but it's just out of my reach. So I'm going to go grab one to show people what that is.
Sure. And the answer is yes. They are very good. If you can get a hold of one, absolutely wear it. That's what Dr. Fauci said also. They have tended to be used almost exclusively in healthcare settings where the risk is highest. However, if it's now not a national shortage any longer. In those days, we had a severe shortage of N95 masks. So, to these challenges. So it is necessary to mask, and we certainly want to mask as many people as possible at all times. There are, so I see the comment from Barb. She says it's disappointing about what we're going to do with tourists. Well, we don't think tourists should be allowed to be out without masks. And I did ask for the legislature to pass a law to allow us to fine them. The idea of finding anyone $5,000 or putting them a year in jail is not workable. It just, those cases get dropped. That's for her. That's my answer. But yes, wear a mask. If we can buy a lot of extra N95 or KN95 masks, it's a good expenditure in my opinion. And buying them in mass with county dollars or state dollars, totally reasonable. We are getting to the point now where we're at lower and lower risk, but you could strategically use them. Let's say you're in the tourism industry and you're a front desk worker, or you're at the airport and you're seeing people come in, then it's good. And that thing pinches over one's nose and it's kind of good. I mean, it is a thick mask.
Okay, I'm going to, just so I can get past that virtual background. This is what an N95 mask looks like. And this is actually the official, you can see on the site it says N95. It's not the KN95. We get them, my husband gets them, we get them for Pacific Biodiesel because we have processes that we've been using these for years, even before the pandemic. So in bulk, I've had people tell me that they found places they can order them for $6 to $10. In bulk, they're $1.50. So they're not expensive if we can find a source for them and money for them for the entire state. Let's see, the next question, will vaccines be available in pharmacies? Can we choose the type of vaccine?
Yes, and yes. They'll increasingly be available in all the pharmacies. We've authorized the pharmacies, so it's good, and people should choose what they want. Like I said earlier, if you have any risk at all, get the ones that demonstrate like 95% immunity. It's way better. But if you are young or of low risk and you don't have other individuals in your family that you're exposed to a lot, probably the Johnson & Johnson shot's gonna be very popular because it's one shot, it's done, and it provides 66 to 72% protection. The one concern I have, and they're testing all this, is the variants. They seem to think that it's possible that some of the variants, like the South African variant, is a little bit more resistant to some of the shots. And we have to be careful about that because certain variants could become endemic, but they will tend to be knocked out in general if most of the population, and that will be the case, most of the population gets these other shots, which is the Pfizer and Moderna.
Okay, and then I think you just almost touched on this. Is there an effort, either statewide or countywide, to educate to counter anti-vaccine misinformation?
There is a lot. I hear that question quite a lot. I mean, I'm spending a lot of time on TV trying to encourage people. I mean, I got the vaccine happily as a healthcare professional. Also, I had COVID just because I caught it, and I still wanted to be vaccinated to be safe for my patients like this weekend. But we're pushing back a lot. We're monitoring social media a lot. I think most people get it. I mean, I came from Kau. That's where I grew up basically when I was in young adulthood. And there's a lot of anti-vaccination sentiment down there in the countryside. But there also was there was only 4 people per square mile. I mean, it was literally designated a frontier. So they had very little disease there. So one does not need to be connected to the other. We just have to keep pushing. I will tell you this, that the numbers were hovering around 56% that were willing to get it. And I've been giving talks every day, 2, 3, 4 times. And I've been able to get people up over 85% for their institutions and so on, just when I characterize what I actually experienced and what the data has shown. Very low risk, not no risk, but very low risk.
Okay, somebody wanted to know the 75 cases a day that are sampled for variants that you mentioned earlier. Is that statewide or countywide?
I hope I didn't misspeak. Per week, just so I'm clear, 75 cases per week statewide. They're able to point their algorithms at any different part of the community or risk group or where people have traveled from. And then they do 300 statewide for the month. And I have encouraged the Department of Health, some of the personnel, to do a little extra sampling on Maui right now, because the rate's up a little bit, and we don't want to catch the unlucky break of getting a cluster of cases that were, the UK variant. And if we see it's persistent, they're tracing more carefully now, especially when there's a cluster. So, all these things these are considerations. It's very difficult to do. It takes about 7 days to do the full genetic analysis, but they can, in the initial sample, see some of the variation of the coat of the virus to give us at least a clue before ruling it in or out as a variant.
Okay, thank you. And then Josiah, I have a question for you. And I'm going to give you 2 questions. If you can't answer the second one, it might be something that Josh can answer. But the first one is, are there any demographic or geographic hotspots on Maui that deserve extra attention?
Oh, okay. I thought you were going to do 2 at once. Yeah, so I did mention early on, kind of what we're seeing right now is a little bit more centralized in central Maui, a little bit of more activity in South Maui that we're seeing. And then those are primarily, geographically, those are primarily the locations right now.
Okay, great. And then the second question is, who does the mask count surveys and how is the data collected? So I don't know if that's one that you want to answer or you want to.
Lieutenant Governor might have more information on this, but I believe it's done through the Department of Health. And I'm not sure, I think they use volunteers to go around to different locations and survey different areas. And they report that, I think, weekly. But maybe Lieutenant Governor, if you have any.
Anything to add?
That's right. And we also do telephone sampling and so on. And I know it's hard to believe because sometimes if I go to certain areas, there's certain settings where it seems like nobody's wearing a mask. I mean, there's no doubt about that. Now that has tended to be tourist centered places, and tourists have not in general in general been our largest challenge with the cases. It's often been because they have a more limited overall time spent in direct contact to be a close contact with our own residents. Not that it's a non-problem, but less. So it's very possible that they're spreading amongst tourists at raves and so on. But they're more likely to be spreading it to themselves and going home than they are probably to cause a big outbreak. That doesn't excuse the behavior. It just explains it a little bit.
Okay. Then a next question, then I'm going to, Tina has an announcement, but what is the status of the employer vaccination form? What is the timeline for employers to get a response to vaccinate their workers?
So that's been a great challenge, right? So the what people don't realize is that 65 as of Friday, last Friday, 6,500 applications came in. So 6,500 businesses submitted to be given preferred vaccination status in 1B. So they're wading through it. That's why some people hear that somebody got approved and somebody still hasn't. They might be 4,000th on the list just to be vetted. Truth be told, it would have been better to accelerate through the vaccination process with some form of honor system based on direct front-facing individual workers with a quick question, because it's so onerous to get through that part. It's easy to do ages. You can characterize that quickly, check someone's ID, that's it. When you try to go and separate 1B essential workers from 1C essential workers in a document, it's really tough. And it just creates a lot of challenges. We're going to actually end up getting through a lot of the higher risk categories before we even finalize some of those forms, because you can easily assess 75 to 74-year-olds. You can't easily assess some of that.
Okay. Well, and then also maybe just as an aside, are we working on this, the system to try to streamline, when people are called? I mean, I've had people tell me that they get a notice or put on a list, they're ready for their vaccine, they call up and they're on hold for an hour or 2 hours. So, those are some of the logistical problems that seem to keep going on. And I don't know if they're state or if they're county, but it's frustrating a lot of people, including myself, because like I said, today I wasn't able to sign up. I got a notice to sign up. When I went to sign up, I was told I wasn't on the list.
Well, let me comment on that a little bit. So not to make an excuse, because we are going to go to a centralized sign up application sometime in the next week. So that's going to be way more helpful. And it may schedule people fairly far out, but at least it will be done that way. But consider this, for the purposes of this project, 900,000 out of our 1.4 million individuals, setting aside, by the way, a couple 100,000 kids and some people that are utterly old and can't do anything on the computer, 900,000 people all with the same goal, to get through a website and get signed up for something. And there's nothing else that we've ever had that's come anywhere close to sign up 900,000 people without extra resources of consequence. I mean, it's a challenge, not an excuse, but it's a big challenge. And on top of that, it turns out to be relatively moot as a point, because I can tell you down to the 200 or so, plus or minus, how many vaccines we actually have at any point. And for clarity, so we went from 335,000 to 385,000 vaccinations in state, right? That's enough to do 192,500 people for both their shots out of the 900,000. So if you can imagine yourself outside of our 75 plus kupuna, which is 109,000, or the 40,000 healthcare workers, or the 50,000 direct first responders, you probably shouldn't have even tried to sign up quite yet. Although the good news is, in the next 2 weeks alone, we'll do another 175,000 shots, probably, given what we're getting in. So it will kind of accelerate now. So that's going to be timely to get that website up. But I know, I would love it. I really wish we just started with 500,000 shots and we just said, have at it. That would have been refreshing, and we would have erred on the side of our elders.
Right, exactly. I'm going to go real quickly to my friend Tina Wildberger. She has an announcement to make about South Maui vaccine. Tina?
So I was thrilled to learn today, Maui Health Systems, our hospital, has, because they're now a Kaiser affiliate, and we have that Kaiser clinic in Kihei that has been closed for almost a year. They are going to start doing vaccines in South Maui 2 days a week. They're starting tomorrow. They're going to do it on Wednesday and Fridays from 9 to 5. This week is already full with canceled, rescheduled appointments that they've called back, but they're committing to doing this through the entire vaccine program. And I really want to thank Mike Rembis for making this possible. He promised to bring vaccine to South Maui, and it has come to fruition. So they're saying that soon they're going to announce the reopening of the Maui Health VAMS portal. Soon, might be this week. So hopefully it's super soon. Their website is www.mauihealth.org/COVID vaccine. And so we will have the opportunity 2 days a week to get vaccine in South Maui in short notice. Thanks a lot.
Awesome. Thank you so much.
That's great news.
I have a question back for Josh. It's a legislation question, and I already know the answer for Tina, but someone is asking your stance on HB 1286 on uniform safe travels. Do you support the counties being able to? I know that Tina opposes this bill and supports the county's rights to make our own. And so, is that something you feel like you can answer right now, Josh?
Oh yeah, it's an overreach by Speaker Psyche, and it's not nice. We should simplify our rules, no question, but you can't legislate one single system for everything, especially because you guys have been taking on extra work on Maui. So it adds insult to injury to you.
Yeah, appreciate that. And the council just passed a resolution on Friday that I brought to the floor to oppose that bill. So
the governor will veto that if it comes there. I bet you $1.
Okay, that's great to know, because I think this originated. The best example we have is the beaches. The original law that you couldn't go on the beaches that the governor came up with towards the beginning of this whole pandemic lockdown was really offensive to people on Maui, and I think it was created because of the situation in Waikiki. Our beaches are totally different. We don't have people sitting towel to towel, and so we are able to social distance.
But that rule was particularly stupid.
Yeah, I agree. And there's no way to police it, because you can sit on the beach and you see a cop coming and then you run into the water and you're okay. Do you have any final notes on how to find out how individuals can find out if they are qualified, if you don't know if your company or your business or where your place of employment is on that list?
Yeah, it's a challenge. What I can do is I can, of course, direct people to the hawaiicovid19.com website. It hasn't changed much. The essential lists are what I shared in my PowerPoint. We are going to constantly update on my social media and TV when we open up new groups. The main indication will be soon we'll be able to open up en masse all those who had been characterized in 1B once we touch 1C. See, the magic of opening 1C is really that everybody from 1B should have been approved. So that opens up a larger block. You can't open up 1C totally, though, to your question, because 1C includes 400,000 individuals with chronic disease. That's why that has to be stratified a little bit. And that's why I'm trying to be very specific about that. Again, I'll say it: on oxygen, getting treatment for cancer, or on dialysis, any of those criteria should enable a person, plus those 70 to 74 should go right away when 1C is opened. And Kelly, I don't know if this helps you. I don't want to offer something that's uncomfortable for you, but I've noted that there's a lot of questions, and I'm happy to do a speed round and just do it if you want, because I know how much people, if they've made the commitment to get on, I'm happy to just roll through some of those for 3 minutes.
Yeah, because I've been just going through, my staff is going through and trying to consolidate some of them. So if you just want to go through, Josh, and just start in on the questions that you see and just read them off and answer them, that's great.
Yes. Okay. So why isn't Maui prioritized? We talked about that. There may need to be if we continue to see high case rates. Mass compliance, a joke. Sometimes that is true, but it's often people not from here and they're less risky. How do we reduce the importation of variants? Well, so far we've only had one on Maui, is my understanding, but it's pretty difficult. And going to the Kauai plan is not possible. We would just die. Though I understand what they're doing. President Biden wants all states to provide vaccines to 60 and up. Why is Hawaii one of the fewer states not doing this? None of the states are doing it, honestly. No one has more vaccine. We're 8th in the country right now for vaccinating our citizens. I mean, I'd like to be first, but 8th is not terrible. we're often worse than eighth at stuff. Who did the mask wearing study? That was Department of Health. Please reference the data in case rates. Maui's case rates greater in city and county. That has been difficult. And we have those numbers based on 100,000. That's the numbers I use in my Wednesday update. No statement from Hawaii state leadership on the Safe Travels program to keep the new variants from coming into this. We update every time we see a variant, just so you know, but I will gladly do that anytime we hear one. And the Department of Health is actually doing a pretty good job assessing that. Did the mask team go to Kaanapali and Front Street? I don't know, but I know Kaanapali, but I don't know if they went there. Couple specific questions. The catch up on the vaccinations is really a catch up on the reporting, although we all want to surge, and I'll make sure we do what we can to get extra tests best I can. And best vaccinations. Someone asked about the most effective N95s. Just make sure we don't get ripped off. Kihei beaches with some large gatherings in tents with no masks. Law enforcement is county, and I really appreciate what the county's doing. It's a lot of work. Let's see. Recent county of Kauai data said that 51% of travelers tested positive did so after they arrived, but had no quarantine. I don't think that that's correct at all. I don't believe that those numbers are valid, and there's been no spread on Kauai. Only 300 samples a month of the genetics. There's a machine that can do it. It would take supercomputers in addition to additional machines, which would cost far more and it'd be impossible to get. Most states don't even have the capacity enough to send it to the CDC. Let's see. Why is DOH persisting in using age to prioritize vaccines when other coefficients are worrisome? I think I covered that for severe illness. Although it is true that age over 85, people are 6,000 to 8,000 more times likely to die than low risk people, and it goes down, but you don't really get to low risk until you get under 60. So that's kind of important. Speak specifically to the current situation at Maui's hospital. They're saying that the COVID unit is bad. I can't agree with that. I mean, we all have challenges, but the cases and the fatalities have been low. Someone asked, how can we collect data on mask wearing in Maui? Where are the observations taken? That was, I believe, addressed. What's considered out of the woods? Well, every other state would consider us out of the woods. We're number one in the country for low rates, but out of the woods is basically when we get down to a point where there's almost no spread whatsoever. We're in the teens and we continue to vaccinate over 10,000 people a day. And then someone asks, why am I saying people will be immune after vaccination? 70% herd immunity, because 70% is the threshold to begin to get herd immunity. Plus, what you guys don't know is that the military is vaccinating their people, and those numbers aren't included in these numbers because they don't give all of us all the data. But that means we're also getting additional herd protection that way. But 70% we will begin to get some immunity. Plus, remember, people have been infected also. We've had 27,000 out of our 1.4 million infected confirmed. We probably had twice that number, just not been able to count everybody. So those are kind of some of the highlights. I don't want to take us too much longer, but I see other questions, and I'm happy to share as time goes by.
Okay, and if we can hang out just a few more minutes, I just wanted to go back to our Deputy Managing Director. And if you have any thoughts and final words on enforcement of masking. Josiah, I know we're doing this mask up, but what is the county doing for enforcement? Because is it going to continue to be complaint driven, watching for big social gatherings and things like that? So can you just speak to that?
Yeah, so it's definitely a challenge everywhere, not just in Maui County, but in other counties as well. It really takes a multi-pronged approach to it. That's factoring in, education, marketing, teams such as like Mask Up Maui County, compliance officers such as like our community police officers actually doing enforcement, park rangers or park security officers doing enforcement, and then really the eyes and ears of the community really help us, because obviously we can't be everywhere at all times, and things do happen to occur. It's just like the speed limit on a highway. We all know going to Kihei, there's people flying on on the highway out there, even though there's a speed limit sign that may be 45 or whatever it is, but it doesn't mean that we shouldn't still continue to stress people to comply with the regulations that are in place to keep people safe. And as possible, we do deploy a variety of resources out to try to help assist in those efforts. But yes, the community really is a big piece in being our eyes and ears out there. And we really appreciate the feedback that they can provide to help us conduct those enforcement measures.
Okay, I appreciate that. And by the way, the feedback from the community is why I've been hosting these meetings. So I really appreciate that too. And you know, when we can get the word out like this, I want to end with my favorite analogy of where we're at right now. And you know, and I've been telling people it reminds me of being on a diet, and you know, you're trying to lose 30 pounds and you get down to 25, and then you just get tired of dieting, and you think, oh well, I think I'm just gonna, you know, stop here, and then you never lose the last 5 pounds, and then you gain back the first 25. And so I don't want us to do that. I want us to get to the end game. And so just encouraging people to continue to mask up, continue to social distance until we get to that critical point where, because right now we're still sorting through a lot of the confusion. I think once we get to the critical mass that you know, you're talking about, Josh and Josiah, that 70%, that kind of gives us a number to aim for. But it also, I think we have to continue to keep those high numbers of masking and do it for each other and ourselves. So I'm going to make a commitment to try to see if I can personally, and I'd love to work with the administration to try to get these masks, these N95 masks, you know, available for the general public, or for at least, you know, get them 100 at a time or whatever. But I'm going to check into that because I know my company orders them. And you know, what's interesting is that we had been using them for years, and we never stopped getting our supply because we order regularly, even when at the time at the beginning of this pandemic, when it was hard to get masks at all, any kind of masks. And now they're more widely available. So I don't think they should cost an arm and leg. I think they should cost $1.50, and we just need to get many, many more of those. So if you have an update on that, feel free to share that with me at any time, Lieutenant Governor, and I can, you know, and the administration too. And, you know, we can do whatever we can do on the council too to help distribute these masks and make us all safer, so we don't have to wear 2 or 3 of the regular cloth masks. Much rather wear one N95. And so with that, any final words, Josh, do you want to?
Just thank you guys for understanding. I'm happy to, you know, continue to give updates, and we will see month over month at least 250,000 shots given. So to your point, Kelly, that's right. If we can keep the weight off, so to speak, which is the weight of COVID off, we will rapidly get to a place that's safe for each month. And I do anticipate that by summer we'll be quite safe, and we'll also have the added benefit of other people that even travel to get safer. And my updates are daily. You know, I do, of course, Facebook and you know, a lot of social media. So just you should go to @LTGov Josh Green. That's my social media handle, and you'll get way more information than you want. But I do it in tight bunches so that it's you know, it's really digestible in a minute or two. It's not like a big press conference that tortures everybody. So I try to do that, and if there's anything super relevant or breaking news, I'll obviously always bring that to people's attention. And I'm very mindful, I'll just end with this, I'm very mindful of what our risks are on the neighbor islands. I know how we have often just one hospital or one specialist at our disposal, though we have significant population. And when you bundle the challenges that Maui County plus Big Island plus Kauai can have with resources, it's relevant. And it's not forgotten. It's been an honor to be a lieutenant governor, essentially from a neighbor island, right? So that's what I'll keep working on. And I think, actually, keep in mind, we're doing very well for adjusted population compared to the mainland. We should have had 2,000 deaths. We've had 400. We should have had 130,000 cases based on population. We've had 27,270, and I was one of them. So it's not always a consolation, but we are doing quite well. And let's see this through to the end. Okay, great. Well, thank you. That was a great wrap up. And I really appreciate your time, because I know you shared with me that your day starts at 3 a.m. So I promised you I wouldn't keep you much more than an hour, and it's been an hour. And I really want to thank our Deputy Managing Director, Josiah Nishita, and our State House Representative, Tina Weilberger, for joining us tonight too.
I think, this is what we've got to keep these conversations going, because it makes those of us who are looking for transparency much more comfortable, and gives us an outlet to find out the information in real time. So the Q&A is really important to our community. Thank you so much. And with that, I will say aloha until next time. And we're working on, I think March 10th is the date that we're going to have our next webinar with our Senator Brian Schatz, and he'll give us some updates from the federal government. That one is going to be, unfortunately, in the middle of the day because he's in Washington, D.C., so I couldn't coerce him into, joining us in the wee hours of the morning. But we will keep people updated on the federal side too. And so thank you, everybody. Aloha and have a great evening. Mahalo.